for a healthier future.
When thinking about catastrophes such as cancer or road traffic accidents, many people overlook a much more common threat: cerebral palsy. Cerebral palsy is the second leading cause of death worldwide. However, it can often be prevented by early warning signals. Are you sure that your brain is currently receiving enough blood and oxygen? A major stroke is often preceded by a so-called mini-stroke. A mini-stroke occurs when an area of brain tissue does not receive enough oxygen and nutrients. Recognizing these symptoms in advance can save many people's lives. What is cerebral palsy? A cerebral stroke is a condition in which the blood flow to the brain is interrupted by a blockage, such as a clot or cholesterol plaques. Without blood flow to the brain, the lack of oxygen and nutrients causes damage to brain tissue. This condition may manifest itself with the following symptoms: weakness in the arms or legs, a speech difficulty, perception and balance problems, paralysis or partial loss of movement. 9 critical signs of brain stroke risk. 1. Persistent high blood pressure. Chronic high blood pressure can damage the walls of blood vessels, causing them to narrow, weaken, or rupture. This can lead to hemorrhagic or obstructive stroke. You can significantly reduce the risk of stroke by keeping your blood pressure under control. 2. Excessive fatigue. Unexplained and severe fatigue can be caused by a decrease in blood flow to the brain. This symptom often precedes a transient ischemic attack. A transient ischemic attack is a warning that occurs when there is a temporary blockage in the brain vessels. 3. Vision problems. Sudden and unexplained loss of vision, blurred or double vision, may indicate that the blood supply to the visual center of the brain has been interrupted. 4. Sudden and severe headache. If you are experiencing the worst headache you have ever had in your life, it may be a sign of a stroke. In hemorrhagic strokes, the headache is usually caused by increased pressure in the head. 5. Numbness or weakness at the extremities. If you notice numbness or weakness in one arm, leg, or side of the face, do not underestimate this. This symptom can often be associated with TIA or stroke. 6. Speech problems. If you suddenly start to have difficulty pronouncing, stammering, or understanding words, seek urgent medical help. This can be caused by blood flow problems in the language center of the brain. 7. Hallucinations. If you experience sensory perceptions such as sight, sound, smell, or touch that do not correspond to reality, this may be a sign that your brain is not getting enough oxygen. 8. Neurological problems. Symptoms such as memory loss, instability, nausea, and vomiting may be signs that a stroke is approaching. However, it is vital to consult a doctor, as these symptoms may also be symptoms of other diseases. 9. Loss of coordination. A sudden loss of coordination that makes you feel like you are drunk may indicate a serious problem with the blood supply to the brain. How can you prevent cerebral palsy? Follow the steps below to reduce the risk of cerebral palsy. Keep your blood pressure under control. Manage your blood sugar. To maintain a healthy weight. Exercise regularly. Eat fresh and healthy foods. Avoid processed foods. Limit sugar, saturated fat, and alcohol. If you smoke, consider quitting. Do not neglect doctor checkups for your heart health. Remember that you are in control of your health. You can reduce the risk of stroke by making yourself and your loved ones aware of this issue. Remember, the most valuable treasure you have is your health. If you like our video, don't forget to like, subscribe, and turn on notification for our new videos.